Hi, everyone, and welcome. We're going to get started in just a few moments. Okay, in the meantime, if you can just put your degree program in the chat and let us know if you are a current student or an alum. We'd really like to just see who's here today. Okay, and I am also enabling captions for anyone who may want to use them.
Maya, if you want to put my otter in the waiting room, I can't make it go away, but you can.
Oh, okay. Oh, okay, I'll do that. All right, no problem. Awesome. All right, so we have folks from almost all degree programs here. Great. Thanks for joining us. All right, so let's get started. Okay, so today's Credentialing Discovery Series is brought to you by the National Board of Public Health Examiners. My name is Maya Lloyd, and I am the Student Career Program Manager for the Offices of Experiential Learning and Career Services here at CUNY SPH. So today we're going to be learning about the CPH certification, including the benefits of obtaining the credential, exam tips, and more. During the event, we are also joined by some wonderful special guests, includes CUNY alumni and current students with the CPH credential. And we will also be joined by our very own Stacy Plitka, who is a professor in the HPAM department and also a CPH ambassador. So with that, I'm going to hand it over to our presenters. I would like to add, though, it is best practice for those that can to have your camera on, just so we can show our presenters and our guests here that we are engaged and receptive of the information they are sharing. So again, if you can, please turn your camera on so we can see your wonderful faces. All right, so I'll stop talking now and I will turn it over to our presenters.
Okay, well, thank you, Maya. Hi, everybody. We're really glad to be here today. My name is Allison Foster. I'm the NBPHE president. And I do have my CPH. What we were gonna do today is we're gonna go through some basic information about the certification public health program, how you can get certified. We'll talk a bit about the exam, how to prepare for the exam, reasons why certification is important. But it's not just going to be me talking. So I reached out to some of the alumni from CUNY that have their CPH, and they're going to be joining me as well. So I think what we'll do just to start is I'm going to have each of the guest speakers introduce themselves, and then we'll get going with the presentation. So I'm going to kind of tick you all off. So Lindsay, you're immediately to my right. So why don't you introduce yourself?
Hi, my name is Lindsay Monaco. I am currently employed by St. Joseph's University. I monitor both campuses on Long Island and Brooklyn for immunization compliance. I am a proud CUNY alumni. I graduated with my master's in public health with a specialization in nutrition in 2012. So this was right around when they were transitioning. So I got to see some of it in action. So that's it for me.
Okay. Allison, would you like to go next?
Hi, so my name is Allison Houston. I am a graduate of undergrad, Brooklyn College, and my first master's, Hunter College. I currently work for a consultation company, but also I'm a adjunct professor at SUNY teaching statistics and research methods. Thank you for having me here.
Seema, would you like to go next?
Hi, everybody. I'm Seema. I'm a nurse, a registered nurse. I've been a nurse for 16 years now, and I'm an alum of the program that offered a dual track master's in public health nursing as well as in public health. And that was back in 2017, 2018. Currently, I work as Assistant Director of Quality and Education at Hospice of New York. And I also adjunct at Hunter Bellevue School of Nursing. So happy to be here. Thank you.
And Victoria.
Good afternoon, everyone. My name is Victoria Sunseri. I am a graduate of CUNY SPH 2023 in the HPAM department. So shout out to my HPAN people. I received my CPH in July of last year. So I've been certified for a little bit less than a year. And I currently work as a project manager with the CUNY Center for Innovation and Mental Health, working on a youth resilience-based project. So happy to be here. Thank you.
Okay, well, thank you. So what I'm going to do is go ahead and get the presentation started, and I'm going to pause periodically and invite our guest alumni to contribute as well. But if you could do me a favor and just start typing in your questions as they have them in the chat. Usually we wait till the end. We usually cover a lot of the questions that are sort of built into the presentation, but go ahead and start adding your questions into the chat. And then at the end of the presentation, if there's anything we haven't answered or you want to talk about a little further, we'll make sure we save some time for that. Okay, so let me share my screen. Turn it on to the right. Nope. Ah, it worked. Okay, we're in business. But I can't see Stacy now. I've just got a little screen. So if you could just send me a chat or something when she gets here. Okay, so today we're going to talk about the Certified in Public Health credentials. I'm really glad you all could be here. So we've been around since 2005, and our board that represents the NBPG is comprised of organizations that you're probably pretty familiar with. So these organizations have seats on our board. They represent accreditation for academic public health departments. We've got membership organizations like ASTO and NACHO and APHA, et cetera. So we really are built, and everything we do is meant to represent the entire field of public health. Okay, I'm going to skip that. All right, so first what we're going to do is talk about the importance of public health. This is where I could talk for really quite a long time, but I'm not going to do that today because we've got folks that are going to give you their personal stories. But I do want to give you just a really short synopsis before we get started. So the idea of certification has been around for a long time. We've actually got formal documentation that has been discussed since as far back as 1980. So lots of think tanks and white papers and committees were formed to really talk about why public health needs certification. And just in a nutshell, the reason why, and we'll get into this a little bit further, but the ideas behind a certification for public health is to professionalize the field. So in public health, as it currently stands, it's a very, very interdisciplinary field, but most fields have both degrees and certifications that support the qualifications of folks working in public health. And it's also certifications are a unifying process, is that no matter your specialty area, no matter what degree you're studying or the particular job you might get, that you have a comprehension of all the areas of public health. So it really ties us together. It's our common body of knowledge that brings us together as a field and does set some standards. So 1980, lots of discussions, probably had been started earlier, but we know they started at least in 1980. So as things go, there was a lot of talk. Nothing really happened. And then finally in 2005, APHA and ASPH came together and created the NBPG. And we've been testing candidates since 2008. So that was my very short version. I'm going to skip past this. I do want to mention that since you're earning your degree, you're all in a degree program, I believe. So the question that we get this less and less, but we still hear this sometimes, is if I'm getting a degree, why do I need a certification? But if you look around and you think about just about every other profession, and this is not just the health professions, the examples I have up here are health professions, but there's so many professions where folks have both a degree and a certification, and that's normally, you wouldn't even think twice about it. It's a new idea for public health, but it's one that's really catching on, and I think will be the norm at some point in the future. So it's just past tax time. Hopefully you all got your taxes done on time. But when you did, you probably went to a CPA. Well, a CPA in most cases has an accounting degree. but they also have their CPA. You probably wouldn't go to somebody who just studied accounting but didn't have a CPA to have to do their taxes, right? Another example that's kind of an easy one is board certified positions. So many, we meet a doctor and they say, well, I'm board certified in X, Y, and Z. They have an MD or a DO medical degree, but then they go on to get a board certification. That's exactly what the CPH is. It's a board certification for public health. And so the idea with the CPH is we're trying to normalize that, is that anybody working in the field is board certified. So that just gives you a little bit of an idea of what our vision is for the certification. And I also want to say, as you're studying, and hopefully completing your degree soon, it would it's going to look really good on your resume if you graduate and you have a degree and a certification. It's really going to make you stand out a bit and show to employers not only did you finish your degree, but you're committed to the field and you pass an exam that that sets the national standards for public health. So graduating with both a degree and a certification is going to help you in the job market as well. Okay, so this is where I'm going to turn to the guests on the call today. So there's lots and lots and lots of reasons why folks want to get certified. And I found, and I'm just going to kind of set the stage for what they're going to share with you, but we found that some folks get certified because they believe so strongly that public health is an incredibly important field, and this is the way to move the field forward. We've got to unify and set the standards for public health and work like a field together. And they believe that certification can do that. And there are other folks that get their CPH because they realize it's going to help them in the job market. It's going to make them stand out. There's a lot of states you get a pay increase if you're certified. Commission officers in the U.S. Public Health Service get a pay increase if they're certified. Some folks get a bonus. And some just believe they get recognition. They might have a greater chance for getting hired, getting a promotion, etc. We found that not everybody's on one end of the scale. They're usually somewhere in between, or they agree with all those reasons, or they have their own. So this is where I'd like to get our guests to share their stories. And I think I'm going to take you off the screen share just because I want to give you all, make sure that everybody can see you. All right, so I'm going to just open it up and just let you all decide who would like to go first.
I'll kick
Okay.
it off one.
Go ahead, Lindsay.
I initially saw this as a challenge. I am always one of those that say, oh, what's the next thing that I can do? How can I make myself stand out from a crowd that, is vying for the same jobs? So I challenged myself, and that was that was the initial reason for becoming certified. But I do think that maintaining the certification forces you to stay up to date on what's going on in the field and with your peers, and you can make really important connections that can be vital to you down the road. I found that being able to go to say that I'm certified, I got this, they send you the nice pin. I don't know if you can see it. I have my CPH pin. I wear it to events. People always ask me, what does that mean? What does that stand for? And that opens a huge conversation. And, it to me, it made it all the time studying and the effort worth it.
Thanks, Lindsay. Allison, did you want to jump in next?
So jumping off of what Lindsay shared, because I got mine in around 2010, way back then, I've had those conversations with people, having to explain that quite a lot. But I tell you why I got it. So in the middle of my PhD program, I had already had a master's from Hunter, and someone from the department just came with the idea that students should prepare for this exam even before they've graduated. I was attracted to the idea that it is a professional standard. I was also attracted to the idea that it would give me an edge above my peers. Not trying to be selfish, but that's the reason. So I started preparing for the exam. And so I did it, and there hasn't been any regrets. One of the things that I particularly like about our certification is that it is affordable. compared to so many other certifications that are crazy expensive, I think we have an edge. That's it.
Thank you. Seema, would you like to go next?
Yes, sure. So at the time I took this exam, I initially got certified back in 2019. So about a year after I've completed my MS MPH. And even though I had already been an experienced RN with advanced degrees, I got the CPH to basically show my commitment to the field and show folks who were going to be evaluating me for a position, job opportunities, that I was committed to furthering the cause of public health, and that it kind of just like validated the knowledge that I had spent my time amassing. So that was why I pursued the certification.
Thank you. Okay, and Victoria.
Sure, I'll hop in here. So I received my certification similarly to the ideas that were expressed previously in terms of how can I set myself apart, especially being a new graduate in this really competitive job market. You know, after COVID, I feel like the public health degree program really took off, and what is public health? People now know what it is. So I felt like everything got a lot more competitive. And so I wanted to find a way to set myself apart. Being in the HPAM track, or the health policy and management degree, I felt like we didn't have a certification that was specifically for policy, but I wanted a way to prove my knowledge basis, not just in policy, but across the different domains of public health, so that I could serve my communities better. You know, whatever position I find myself in, there are specific competencies that the certification in public health make you study and relearn. And yes, you all have those core classes that you take as you're going through your MPH program, but it's really easy to get stuck in just your domain and be really siloed, which is one of the downfalls, in my opinion, of public health. So it really forces you to be able to say, like, okay, this is the language that this particular piece or part of public health uses. And so the CPH exam and studying for that exam and then staying up to date, I feel like really helped me kind of broaden and kind of hunker down on the different domains so that I can be a more effective public health practitioner. And also, of course, to set myself apart, I was actually able to use my CPH certification as leverage to get a different title and higher pay. So, you know, you never know in terms of what your CPH can really get you, apart from the knowledge basis. You know, access to a book club was a really big thing for me, if I'm being honest. I haven't gotten a chance to completely leverage that as much as I wanted, but the CPH has their own book club, which I thought was a really great way to, you know, stay up to date with the literature that's coming out. Public health, you know, we cover so much, and you'll find that especially as you're going through the different domains and preparing for the exam. And I feel like it really makes you be conscious of all the things that you should be aware of as a public health practitioner, no matter where you might function within the field. So that's my take.
Okay, all right, that was great. 4 different perspectives. Okay, well, we're going to jump back into the PowerPoint, and I'm keeping an eye on your questions. You all have great questions. We're going to cover, I'm pretty sure we're going to cover all of it. So, but keep them coming in. Okay, I'm gonna skip a whole bunch of stuff. Well, I think I'm gonna mention one thing, because I know that you all are probably going to be looking for jobs in the near future, or at least a lot of you. So we are seeing lots of growth in the uptake of the CPH. So not every employer is going to list CPH is required or preferred in their job listings. And partly it's sometimes they don't have control over what's in the job listing, especially if you're going to work in the public sector. But what I can tell you is that there have been lots of studies done, and employers do value certifications, even if they don't know a particular certification. So when they see your resume, they say MPH, CPH, they know that you went above and beyond. They know what certifications mean. And so this is just some stats from a study that was done a few years ago. And as you can see that employers really think that certifications are valuable. And one area of growth that we're seeing, which has been really great, is health departments So I don't know if any of you think of work in a health department, but we've got lots and lots of health departments that are getting cohorts of their employees certified, which tells me they're probably looking to hire as well. They think that the CPH certification is valuable enough that they're getting, cohorts of their employees certified every year. So it's been an interesting trend, and I think gives some insight what's going on in the employment area. Okay, so we're going to go through the whole certification process. So we're going to talk about eligibility, which should be pretty easy if you're all students at CUNY School of Public Health. We'll talk about the exam. I know that's where the most questions are coming in. And then at the end, we'll talk a little bit about how to keep your CPH. So for exam eligibility, so we do have some standards. Not, folks can't just walk in off the street and take the CPH. In your case, if you are a graduate student of this CUNY School of Public Health, you would be eligible as soon as your program says that you're prepared to take the exam. The reason why is because it doesn't help us to have people take the exam and not pass. And so most programs probably wouldn't want first semester students taking the exam. They haven't taken the classes yet, but typically once you've taken the core or finished your first year, then your school would let you take the CPH exam. So you can take it as a student. The only thing is if you pass, you'll be provisional until you graduate, but you can use CPH provisional after your name. That's actually a designation. So at least you can tell folks on your resume, I took the exam and I passed it. You just need to graduate to get the full CPH. If anybody else is on the call that's an alumni, then you'd be eligible as well. And we do have other criteria for folks that do not have a degree from a CPH accredited school or program, and for faculty, but I'm going to skip those because I think most of you are students. So first thing you do is you would apply, create an account, and submit an application. Super easy. There's not a whole lot to it because your school will verify that you're eligible, basically. So you just navigate to our website, you go to CPH, and then there's a green button right there and click on Apply Now. So once you apply, we usually tell people give about 2 weeks for your application to be reviewed, and the folks at CUNY, the administration, would review your eligibility, and they'd let us know if you're eligible. As soon as they do that, you'll receive scheduling instructions. You can take your exam right away if you're just raring to go. So you'll receive scheduling instructions, and usually you can take the exam within a few days, actually. However, if you don't want to take it right away, that's fine too. You can wait and take the exam as far into the future as you want. With CPH, we're a little different than most other certifications. Our eligibility is indefinite. So once you're eligible, you're always eligible, and your eligibility does not run out after a certain period of time. That said, if you don't take it right away, that's fine. But we hear from students, from recent graduates all the time, take it as soon as you can after you finish your courses, because it's all in your head. You're going to get out there and start working. And then unfortunately, things start to get a little fuzzy. And so it might be easier, or at least, and probably less stressful if you take it very soon upon graduating. So we do we have an application / exam fee, just one fee. And thank you, Allison. I was glad to hear that you think this is a reasonably priced certification, because that's our goal. We want to make it accessible. So it's just $385. That's all you pay. And we have lots and lots and lots of different discounts for, if you belong to certain organizations or employer-based discounts. So check out our discount page that's on our website, and hopefully you'll be eligible for one of those discounts. There's too many to list, so it just gives you a little snapshot of the top couple ones. But we have a whole page of discounts available. Okay, so what's on the exam? And I'm going to give our guest speakers some time to talk about the exam process and how to prepare. I just want to give you a little background. So we don't sit around in a room and decide what should be on the exam. We don't bring faculty in. We don't bring folks in and make a decision based on what should people be doing in public health? What should they know? We have to, by certification standards, we have to base what's on our exam based on what's actually happening in public health practice. So we go through a process every 5 years or so. It's called a job task analysis, and we survey the field and ask them, what do they actually do? There's a lot more to it. It's a presentation unto itself, but at the end of the survey analysis process, we have a list of all the tasks that are common and important to public health professionals as a whole. And that is what is on our exam. So it's very, very rooted in practice. However, I know your school's preparing you to get out there in the workforce, so there should not be a dichotomy between what you're learning and what's on the CPH exam. So we have lots of specific subtopics, but it's 95 subtopics, but it's too much to share in a slide. So the way we usually think about the CPH exam is on domains, kind of like chapters in a book. And each of these is a chapter, and then there's information within each chapter. So hopefully you're looking at this slide and you're thinking, yeah, these look familiar. I just took a class in one of these, and this is what I'm focusing on in my degree program. There might be a few where you're thinking, oh, I'm just not quite sure what this is all about, but we have lots of tools for you to learn a little more about each of these domains and to make sure you're prepared, which I'll show you in just a bit. So we don't expect everybody to be an expert in every of these areas. That would be pretty difficult. And all of you picked an area of study, and you might have some experience in a couple of these areas, but nobody's going to be deeply expert in all of these areas. So the good news is our passing score is based on the overall score, not each domain. So you don't have to pass each section. And so what that means is if you take the exam and you do really well in most of the domains, there can be a couple where you just don't do well, and that's all right. You could still pass. We just add up all the right answers. So please don't get too focused on the specific domains and think, well, you can't pass if you're not really strong in all of these. And the one I will mention, data analysis informatics, that is epidemiology and biostatistics. And we find that folks worry and worry and worry about that domain. And I would say probably 80% of the angst and the time studying goes to that domain, but it's only 12% of the exam. And so please keep that in mind. If you're spending most of your time on one domain, it means you're kind of neglecting the other domains. So try to use your logic, not your not your fear about epi and bio. But we do see folks kind of overcompensate for that area. So please sort of think that through before you tackle getting started. The other thing I want to mention is we don't have a penalty for wrong answers. We just add up all the right answers. And so when you're taking the exam, make sure you answer every question, even if you don't know, there's a question you don't know an answer to, guess. You're better off guessing than on answering. Don't leave anything blank. And you learn nothing else today. That's just a testing tip you should keep in mind. So I'm going to talk about, let me see, try to figure out when I should have you all jump in. Let me get through a couple more slides, and then I'm going to have you all talk about the testing process, and then we'll go to study resources. So I did see these questions in the chat. When can you take the exam? All year long. We quite literally test every day of the year. We don't have windows, so we're on your schedule. You're not on ours. So you can test any time that you feel is a good time for you to be taking an exam. So we test two different ways. So we offer the exam at a computer-based testing center network. We have 1,400 testing centers or so. They're all over the world. I'll show you in a second where they are in New York. So you have that option. So I know you all have taken these kind of exams before. You go to a testing center, somebody checks you in and they put you at a computer and there you go, right? Exactly same experience. We also offer the exam by live online proctor. And that means you can take the exam on your own computer, a PC or a laptop, you can't use a phone or iPad, but if it's actually a computer, you can take your exam as long as you have private room, strong internet connection, a camera and a mic. That's basically it. A proctor comes online and meets you on the exam environment, and then you can take the exam from the privacy of wherever you want. The nice thing about live online proctor is that we test 24 hours a day. So if you're a night owl and you really want to take the exam late at night, because that's when you do your best, great. You can also take it super early in the morning. You don't have to wait for the schedule from a computer-based testing center. And I'll show you a couple more slides about that. But the bottom line for these is we don't mind which way you want to take it, and neither one's better. It's really what works for you. What's going to make you more comfortable? You need to be in the best frame of mind when you take the exam. And so if one sounds better to you, then I suggest you explore it a little more and choose that option. Okay, so for testing centers, we do have a place on our site where you can search for testing centers. And in this case, this is showing all the states, and I'll show you what happens if you click through in a second. But I did see a question in the chat about international locations, which reminded me to mention that, yes, the CPH is not just for the United States. We've actually tested candidates in and from over 95 different countries. And so we do test abroad as well. Live Online Proctor works great there. We have computer-based testing centers outside the United States as well. So for New York, so I took a screenshot. You can't see the exact addresses here, but I can see a lot of the boroughs, and hopefully you all are near one of these if you're thinking about taking it by computer-based testing. And if you're out of the area, I don't know if any of you are studying remote, you can go back to the state and the previous screen, click through, and it'll show you where there are testing centers, whatever state you happen to be in. And then if you decide to take it by remote online proctor, it's really not hard. It's how I got my CPH. But you do need to be prepared. You don't want to walk in with an out-of-date computer and have internet problems. So we have a long technical list on our website, which is kind of overwhelming. So my suggestion is start by watching the video we have on our website. Just watch this video, and I think you'll know within the first couple of minutes whether Live Online Proctor is for you or not. But it will tell you what you need to do to take the exam by Live Online Proctor. Okay. Tell you what, I'm going to talk a little more about the exam, but I feel like I'm going to get too far into it without letting our guests talk. So let me pause there. I'm not going to unscreen share those. But Victoria, Seema, Allison, and Lindsay, do you want to talk about the actual testing environment and what it was like to actually take the exam?
I can share. Is that I went to a testing site, and it was not it was very similar to other standardized testing that I've done in other testing sites. Pretty standard. Sorry for the phone. Pretty standard. Kind of like rules. You leave your bag outside and things. But I don't know. I felt prepared enough that I wasn't so nervous, and whoever was there, kind of supervising the site, was kind. So it was as relaxed as it could have been for a standardized exam. It was good.
Yeah. Lindsay, did you want to jump in? I saw you came off. Oh, I see. And Allison's off mic too.
I also took it at a testing center. I can't remember which one because I had to take it twice, not gonna lie. I took it twice. I know there was a question about testing limit. The first time it was much more crowded, and I think that was a distraction for me, even with the headphones on. The second time there was nobody there. It was just me in the room. So I think it was a lot easier for me to focus. But yeah, I had a very similar testing center experience, typical to what you'd expect, nothing out of the ordinary.
I also took it. Oh, sorry.
No, go ahead.
I was just going to say that I also took it at a testing center. I did not trust the internet in my apartment, and I had very noisy neighbors. So if that describes your living situation, I would potentially recommend you going to a center. I was lucky enough to also be in a room without anyone else. So I was the only person there. So when I finished my exam, I was able to shout, "Yay, I passed." So definitely an advantage, I guess, in that regard. But yeah, I was very nervous before my exam, and I did check out my testing site and how things would go. I'm living in LA, so traffic was a bigger concern of mine, as well as the testing location itself, because you need to park in a garage and then walk. So I actually did trip the the week before to actually go and see where I would park my car, what was the closest garage, where the testing center was, so that I would make sure that I was prepared and calm the day of.
That's very smart, because the last thing you want is to walk in the room after you've been panicked. Yeah, so that's good tip. And Allison, did you want to? No, okay.
It's
Okay.
been so long, I barely remember. I want to believe it's standard,
Yeah.
places to do GREs and everything else.
Well, if it wasn't, you'd probably remember it. Yeah. Maya?
Can you all hear me?
Yeah.
Oh, okay. I was trying to interrupt before, but I don't know what was going on. Just letting you know that Stacy's here, so um, we can have her introduce herself really quickly because she has to jump to another meeting.
Yeah, absolutely.
Hi, everybody. I'm a faculty member here. You might not know me because I've been on sabbatical for the past year, but my name's Stacy Plichta. I'm a full professor in health policy and management, and I am also a CPH ambassador. And I'd be very happy if you have questions after this presentation to talk to anybody. You can email me or you can call me. Either way is good. Please, again, and Maya, please feel free to share my email. I apologize, I have to hop off because I do have another meeting. But I took the exam myself. It's well worthwhile and it will open doors.
Thank you, Stacy. Good to see you.
All right,
Thank
good to
you.
see you too. Take care.
All right, great. Thanks for interrupting, Maya. Okay, so the exam itself. So our exam is 200 multiple choice questions. It's you get a 4-hour window to take the exam. I used to say it was a 4-hour exam, but that's actually not true. You get 4 hours. And the reason I mention that is because we've looked at how long folks take to take the exam, and they take under 3 hours, which means they have over an hour left on average. And you might be wondering, why is she telling us this? Why do we care? Well, what it tells us is that most folks have extra time. We want you to pass. So we don't want you to rush. We don't want you to have to rush through and not be able to give thought to your responses to the questions. And so looking at these averages, this tells us that the average candidate has more than enough time to answer the questions. So you should go in, and we do have some practice exams. You can check your timing, but we do not want you to go in and feel like you're under pressure and you don't have enough time. And so for folks that do have need medical accommodations and might need more time or other accommodations, we do have a whole accommodation process. And so the window can be longer than 4 hours. But as you can see, most candidates take it in just under 3. So we realize, though, that taking an exam is, it's stressful. Even if you're really prepared, you're still going to worry about your performance. And so we want you to feel confident about how you're going to do taking the exam. And so we keep an eye on the overall pass rates. And you can see that we're in the mid to upper 80s, is that most people that take the exam pass the exam. And part of this is because our eligibility standards set the bar pretty high. A lot of our candidates have a graduate degree in public health. They should be successful on the exam. And the folks that don't have a graduate level degree, they have to have multiple years of work experience. And so we make sure eligibility is high enough that most people are able to pass the exam. So I hope these statistics help you feel a little better about how you all might do on the exam. It's like positive thinking is really important. So for the folks that don't pass the first time, we do allow candidates to retest. And unlike a lot of other certification bodies, there's no limit. You can take the exam as many times you want because we have different versions of the exam basically at all times. And all you have to do is pay a fee, and you get a $150 fee to retake it. And then you get another set of scheduling instructions. You don't need to reapply. So it's pretty simple, but I really hope you all take it. You pass it on the first attempt, just so that you don't have to worry about taking it a second time. But if you don't pass the first time, that's all right. You can always take it again. Okay. So I'm going to go through just a little bit of the study resources, and then this is where I really want to lean on our guest alumni about how you all prepared and advice you could give to folks preparing for the exam. So, so don't feel like when you're thinking about taking the exam and you've seen our domains, you've seen what's on the exam, you're going to have to start from scratch. You're not, because your degree, that's your degree program you're in right now, and if you have any work experience, those are setting you up. You've already got a lot of the knowledge. You maybe just need to kind of, fill in some gaps or refresh something you might have forgotten, but you should be very close to prepared to take the exam as a master's level student. So you're absolutely not starting from scratch. So we have a whole page on our website where we have study resources available to you, and I really hope you'll check them out. They're interactive, and they're sort of built for different approaches people take to studying. The first section is self-assessment. And this is how you can figure out, how much do I need to study? First thing, and I'm just going to show you really quickly, this, I would take a look at our content outline. Remember I said we have 95 different topics on the exam? The content outline is actually a list of all those topics organized into different domains. I wouldn't go with a first pass. I would just scan it, and you're going to go through it's like 8 pages long. When you scan it, you should get a pretty intuitive sense of, oh yeah, I know this. I just took a class in this. You might hit a domain where you think, I don't think I ever took that class. I don't know much about this. That might be where you want to study, but just do a quick run through of the content outline, and I think that'll give you the best sense. Skip that. But the other thing we have 3 practice exams. So what we suggest is take one practice exam early on when you're thinking, okay, I want to take this exam. Take a practice exam. First 2 are free. And just take it once. What we suggest you don't do is take it over and over and over, because after a while you're just memorizing those questions, which will never be on the actual exam. So just take it once and see how you did. And what's kind of neat about the practice exams is that at the end, they will tell you domain by domain whether it was a strength or you did okay, which is still good, or if it was a weakness. And so you'll get a summary of each domain and where it falls. And if you find that you had lots of strengths and just a couple weaknesses, you might be in good shape for taking the exam. I can't promise you that, but it's a really good indicator. If you had lots of weaknesses, then that means that you probably need to study a bit more. So definitely take a practice exam early. And then our suggestion is study. We've got some tools you can use. You've got your textbooks from school, and then go back and take a second practice exam. And then hopefully your performance will have improved. So once you figure out, okay, this is what I need to study, this is what I need to focus on, we have a number of tools available. So on the left we have I've got slides for each of those. We've got webinars. We do live webinars about twice a year now is our cadence. They're about an hour and a half per domain, and we record them all and we put them all on our YouTube page. And so you can go to our YouTube page, you can just click right through from that website and watch all the webinars that are archived. And we get really, really good comments about the webinars because they're in depth. The presenters have, Q&A at the end, and folks really tend to like these a lot. We also have 2 study guides that other organizations have published for us. One, the one on the left is the one published by Springer Publishing. Stacy, who was just on the call, is actually the editor of the new version. They haven't published it yet, but when it comes out, hopefully by end of summer, maybe fall, that'll be refreshed and mirror our new content outline. And then the one on the right is published by APHA, and that is the 2nd edition. And they're both really good resources for you to use if you feel like you need to brush up. We also have a whole subscription-based system where you can really drill into practice questions. The system has flashcards you can build. Let's say you've got a couple domains where you're not as strong. You're not worried about a few of them, but some of them you're more concerned about. You can actually build exams just focused on those domains alone. So this system, we call it Test Run, has a lot of functionality that you can use. So again, we've got lots of tools that you can use, but you know, you're in school right now, you've got your textbooks and classes. You could form study groups, a lot of different things that you could do to make sure that you're ready to pass the exam. So I'm going to break there and go back and ask Lindsay, Allison, Victoria, and Seema if they could share some tips. How did they get prepared to take the exam?
That's I'll say. I don't know, I'm probably gonna age myself here, but I liked the physical books because I could write all over them, highlight them, take my notes in the margins, things like that. And I studied, I want to say probably for 3 to 6 months because I was working full time too. A lot of us, I think, are also working and studying. So I gave myself a lot longer. Because I think trying to cram for this is not something that I would recommend at all. You just stress yourself out. Make sure you get a good night's sleep the night before. Don't consume too much caffeine. And eat a good breakfast or depending on what mealtime you're going to be there, eat a good breakfast. And the testing center I was at did allow you to bring snacks. You had to leave the room, but you're not going to, if you need to take 4 hours, you're not going to sit there and, with a hungry stomach. In my case, I was allowed to leave, and stand in the lobby and just eat a protein bar so that I can get back to it. But those are, and the online review questions are great. Like they're always updated. They're pretty relevant to what the test will actually be. So I highly recommend taking the practice exams too.
I could share. I exclusively use the materials on the website. I didn't need to get anything else. And I want to praise your UI UX person because the layout of the website is so intuitive and it's so easy to use. So it's like wherever you think something on the website is going to be located, that's where it is. But yeah, I only use the materials on the website. I did print it out because I do, like Lindsay, I enjoy having the paper feel and able to take ink notes. So I did that, and one study strategy that I use regularly is creating flashcards with actual index cards and a writing utensil, because for me, I learn when I write it, and then I learn again when I practice the actual card, using the actual cards. So that's what I did, and I didn't stress about trying to become an expert on everything. It's kind of what Allison was mentioning earlier. Just a general knowledge of all of the domains was good enough to make me feel confident when I walked into the test taking room. So yeah, thank you.
I'll go next. So when I took the exam was a bit different. The content was very different. You had to do environmental studies, biostatistics, and just a whole bunch of different subject matter. So what we did is we kind of studied in a group because the exam was kind of newish and we were not sure. So a bunch of us got together, at least I remember that much, and we studied the different content and we shared it. Fortunately, one of the good things about the CPH exam is that it is there's an effort to evaluate the study, the exam every 5 years or something, I think. And so because of that, the results of that task force effort, the exam itself had changed to facilitate what public health people actually needed and wanted. So the exam is just very changed. I remember I was actually involved in the new guide, I think in 2019, in writing new exams. And one thing, I've been involved in writing exams. So I went from creating exams for environmental health, biostats and all that. There's something very different. And I really appreciate that because organizations do not really put that kind of effort to change an exam so much to facilitate the need. This is one good reason we should actually do the CPH, become CPH. So in that process, I see that even the process of studying for the exam had to change. So people are going to have different experiences. But one of the things that CPH has done is provided rich resources on the website to prepare for the new version. So again, it's all been just good work from Allison and everybody else involved. So thank you.
Yeah. Victoria, did you want to add to that?
Sure, I can if there's time. So I wanted to make sure that I was going to pass the first time around, like as much as possible. So I studied. It also took me about 3 to 6 months working full time. I just finished my MPH. I was a little bit mentally tired, as I'm sure most people are. So I took the practice exam before I started studying to see what domains I might be a little bit more weaker on. And then I watched the recordings on YouTube from past study sessions, as well as there was happened to be a study session that was going on live. So I was watching those and reading the chapters. So I kind of had this system that I had the physical book too, because as they all mentioned too, I'm also a writer, highlighter, note taker. So I basically read the chapter. I had like a system where I'd read the chapter, I'd watch the video recording that was available. I would take notes on both. And then as I would go along, after I did that for every domain, every chapter in the book, I went back and looked at what I had highlighted as maybe something that I had been a little bit weaker on. I would just basically reviewed all the notes I took after I was done condensing all the information and then made flashcards based on that information. So I studied using those after, and then I took, when I was a little bit closer to the end of my studying process, I took another practice exam with maybe 3 weeks or so still left before my exam, so that if there was anything that I was particularly weak in still, I had time to go back and say, okay, I need to focus on this. But it was enough time in between when I first took the practice exam and then when I took it again to make me feel like I wasn't just memorizing the answers to the questions. Also, the practice exam is pretty lengthy too. And it's a great resource. But I say that all that is to say is it's a little bit hard unless you're taking the practice exam like every day or something to memorize all the answers, which is good. It is basically what I'm saying. So I was able to kind of gauge my knowledge between those two practice exams and really focus my study, but also make sure that I was covering every topic along the way.
Great. Okay. So the last thing I just wanted to mention is recertifications. I'm not even going to pull up my slides, just to talk you through it. So the takeaways, a certification, it's letters after your name. You do need to maintain it. It's kind of a living, breathing thing. So once you pass the exam, it doesn't last forever. Every 2 years, you need to report 30 recertification credits. But the way we built our system, because public health is so diverse, and people come from so many different areas in public health, is that we don't have prescribed activities you need to do. You actually don't even need to attend conferences. There are a lot of certification bodies where you have to go to professional conferences, but that's expensive, and we didn't want to make recertification inaccessible. So you get credit for professional activities, like if you publish or you give a lecture or volunteer work you might do, board leadership in another organization. So just file this away. We're a ways away from you even thinking about recertification, but it's not difficult to maintain. We purposely make it really attainable. So I thought, why don't we just go through some of the questions and then see if you all have any others, and just make sure we answer all the questions in here. So starting at the bottom, I did see Victoria and Lindsay, you answered this, but yeah, are there breaks during the exam? Yes, you can take a break. If you need multiple breaks, again, for medical accommodation reasons, you can submit a request. Otherwise, yes, you can take a break during the exam. The next one, I know the CPH exam changed last August. What's different? Every year we update the exam. We changed the content outline last August. Honestly, it was just a pretty minor change, but I think the change that was significant is we changed the weights. Our domains used to be 10% for each of the 10 domains, and we reweighted them a little bit. So now, some are now 12, some are 8, some are still 10. So maybe there are a few more questions on specific topics and a few less on other topics. But that was about it. We didn't make any other major changes to the exam. Let's see. Okay, here's one. How will I know if I'm ready to take the exam as a student? I maybe talk to your school and see if they think you've taken enough courses, but I think the advice of the alumni, take a practice exam and see how you did. Look at the content outline. Does it look familiar? I think there'll be a point where you just start thinking, I can do this. That's probably when you're ready, but definitely talk to your school. You don't want to apply and have, before I think you've gotten some guidance from them. If you were to apply and then they don't approve your application, it'll be fine. We can, revive your application at a later time. You wouldn't need to apply twice, but it's always better just to check in with them and find out. I've taken my first full year and I'm in my second semester is the second year of can I take the exam, and they should be able to let you know. Okay. So how lengthy is the preparation? So we actually survey folks after they take the exam on how they prepared. And we found that the average, this is average, and you know what averages tell you, but the average is 3 months. So we do see people take a year or two, and I think they're taking classes, or I think a lot of times they just got busy. But sometimes people will say they took over a year to prepare. And maybe they didn't have such formal background, but as a student, I would think it's just going to be a refresher of what you know. So the average is 3 months, but if you like to take your time and plan ahead, then absolutely you can take 6 months. But it's really a very specific to where you are and how prepared you feel. Okay. All right, here's a good one I'm going to throw out to the alumni. If I'm already working at the New York Department of Health, what is the added value and benefits of getting a CPH? So are you all glad that you got your CPH, and do you think it helps you in the workplace?
For me, 100%. I found that when I was able to walk into an interview and they would see my resume or my CV, and they would see that I had CPH after it, it does say something. If you're in that field and you're doing that work, it says something that you did take that extra time to go above and beyond, and you understand the bigger picture, not necessarily just because as was mentioned before, a lot of us have specializations in the public health field. This just says, hey, I'm specialized in this, but I also know a lot more about the field in general, and it's worth hiring me. It's worth talking to me. That's in my experience what I've done. And I've worked with public health commissioned officers. A couple of them actually tried to take the test and didn't pass. And they told me, oh, you passed that? That was hard. Like, you passed that? That's amazing. So just being able to say you took the test and you passed among your peers is a pretty amazing thing in and of itself. So it is worth it 100% for me.
Unfortunately, it looks like we're out of time. Shoot. I wish we could keep going because there's always more to say, and it's been really wonderful to have some of your alumni here. So Lindsay, Allison, Seema, and Victoria, I might ask you all if you could share, if you're willing to be contacted by anybody on the call, if you could just put it in the chat. So they could follow up and ask you questions if they got them.
And I will definitely take that information down and put it in the post-event email if you all don't mind.
Yeah, and I will put our general questions email in here too. And good. Well, this has been a pleasure. So I hope this was helpful to you all. And please, please, please reach out to us if you have any questions. We're here to support you. And we're excited for you. So we would love to hear from you.
Yes. Well, let me just say thank you to our speakers. This has been wonderful. It's always nice to hear, firsthand experiences from those that have actually gone through the certification. For everyone else that's joining us today, you will get a post-event email with the recording and other resources. So thank you so much and enjoy your day.
All right. Thanks, everybody. Bye-bye.